three.
Hi, my name is Roseanne. I'll be your nurse practitioner today. What brings you in?
I fell off my bike and I got this wound.
Oh no, I'm so sorry to hear that. Looks like you sustained a laceration from your fall. What we will be doing is a simple interrupted suture to close up that wound.
What is that procedure?
So it's a suture technique used to close the wound. It's called interrupted because it's going to have individual stitches. Since your skin is well approximated and there's no tension on the skin, this is the perfect technique to use for suturing. We will be having you sign this consent to consent for this procedure. I just want to let you know that we will be using local anesthesia. A lidocaine 1% will be used around the surrounding areas of the skin. Do you have any allergies to lidocaine?
None so far.
Perfect.
What are the pros and cons of this procedure?
Perfect. Thank you for asking. So the pros is getting sutured will close the wound. It will avoid infection and it will promote wound healing. The con would be risk for dehisce, but that'll be very rare, and we'll make sure if it does happen, you're aware of the signs and symptoms. All right.
I feel well informed.
Okay.
And let me sign the consent.
Before you sign the consent, let me just let you know the contraindications for suturing, which would include if the laceration is an infected skin, but your skin doesn't look infected, a deep puncture wound, and a superficial wound that could be healed up on its own. Unfortunately, for your case, you do need some suturing in order to close the wound, and it won't heal on its own if there is no suturing provided. Also, we will be using a non-filament suture, meaning that it is non-absorbable, meaning that you would have to come back in 7 days for us to remove it.
Okay, I understand.
All right, so here's the form right here, the consent, if you could sign it.
Let me sign it.
Hygiene is very important. So we'll be going sterile field. All right, we're in sterile field now. Absorb the wound. We'll be irrigating the wound. We'll be patting it down, the excess water. Okay, let me get this right here. All right, with my 1% lidocaine, we'll be going in the surrounding areas. That's our local anesthesia. Perfect. Next, be using our nylon monofilament, non-absorbable. Okay. All right, good. We have our tools all here. We are in sterile field. Okay. So we don't want to start at the end, always in the middle to avoid a gaping wound. We'll insert the needle at 90 degrees, 2 centimeters out at equal distance. Next, we'll be performing a surgeon's knot. We'll be wrapping the suture twice. and then grabbing the end of this end of the suture, creating a knot. We don't want the suture really tight as it will develop an overlap in the skin, and that will create a keloid, which is not what we want. We want the knot at either side of the skin and not on top. Okay. Then we'll be doing another overlapping once. Grabbing the end. Okay, that's our surgeon's knot right here. Okay, we'll be alternating in and out towards me and away from me 6 times. And so 1, towards me. Okay, 4, 4, 5, and 6. Perfect. Cut right here, cut right here, and that is a simple interrupted suture. We'll be doing this 2 more times. Check on the patient to make sure the patient's okay. Patient looks fine. Surgeon's knot. 1, 2, grab the end. Good, not too tight, so you don't want a keloid. Surgeon's knot. Okay, an alternative again. Grab the end. 1, and 1 more. Okay, it's our second one. Okay, 1 more. Okay. Surgeon's knot. One, two. At the end of that, on one side. Good. One. Good. As an antibiotic prophylaxis, we'll just be putting a simple gauze and tape just to for any oozing, and we'll keep that on for 24 hours, and that's the procedure. Hi, so we just finished your procedure, no complications at all.
Thank you.
All
so
right,
much.
so for our post-suture care, that involves avoid the dressing for 24 hours to help with the healing process. Afterwards, you can remove this the gauze right here with tape, and you can clean with soap and water only. Avoid any antiseptic such as alcohol or hydrogen peroxide. And then we have for here bacitracin. This is a antibiotic prophylaxis just to prevent any bacteria since the wound is still fresh. What should we watch out for these 7 days? Any increased redness, swelling, if you start to have a fever, any pus formations, call me immediately and come to the clinic.
Okay, I understand.
All right, perfect. So we'll see you in 7 days, Mr. Velasquez, and we'll see from there if the wound is completely healed and if we can remove the sutures.